Hello and welcome back to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News, and I'm joined by some of the best and smartest health reporters in Washington. We're taping this week on Thursday, June 5th at 10 a.m. As always, news happens fast and things might have changed by the time you hear this. So here we go. Today, we are joined via video conference by Miranda Ollstein of Politico.
Hello.
Lauren Weber of the Washington Post.
Hello, hello.
And Jessie Hellmann of CQ Roll Call.
Hi there.
Later in this episode, we'll have my interview with my colleague, Ariel Zients, who reported and wrote the latest KFF Health News Bill of the Month about a Medicaid patient who had a medical emergency out of state and got a really big bill to boot. But first, the news. And buckle up, there is a lot of it. We'll start on Capitol Hill, where the Senate is back this week and turning its attention to that big, beautiful budget reconciliation bill passed by the House last month. And we'll get to the fights over it in a moment. But first, the Congressional Budget Office on Wednesday finished its analysis of the House-passed bill, and the final verdict is in. It would reduce federal health care spending by more than $1 trillion with a T over the next decade. That's largely from Medicaid, but also significantly from the Affordable Care Act. And in a separate letter from CBO Wednesday afternoon, analysts projected that 10.9 million more people would be uninsured over the next decade as a result of the bill's provisions. Additionally, 5.1 million more people would lose ACA coverage as a result of the bill, in combination with letting the Biden-era enhanced subsidies expire, for a grand total of 16 million more people uninsured as a result of Congress's action and inaction. I don't expect that number is going to help this bill get passed in the Senate, will it?
We're seeing a lot of what we saw during the Obamacare repeal fight, in that even before this report came out, Republicans were working to discredit the CBO in the eyes of the public and sow the seeds of mistrust ahead of time so that these pretty damaging numbers wouldn't derail the effort. They did in that case, among other things. And so they could now, despite their protestations. But I think they're saying a combination of true things about the CBO, like it's based on guesses and estimates and models, and you have to predict what human behavior is going to be. Are people going to just drop coverage altogether? Are they going to do this? Are they going to do that? But these are the experts we have. This is the nonpartisan body that Congress has chosen to rely on. So you're not really seeing them present their own credible sources and data. They're more just saying, don't believe these guys.
Yeah, and I mean, some of these things we know. I mean, we've talked about the work requirement a million times, that when you have work requirements in Medicaid, the people who lose coverage are not people who refuse to work, it's people who can't navigate the bureaucracy. And when premiums go up, which they will for the Affordable Care Act, not just because they're letting these extra subsidies expire, but because they're going back to the way premiums were calculated before 2017, the more expensive premiums get, the fewer people sign up. So it's not exactly rocket science figuring out that you're going to have a lot more people without health insurance as a result of this.
Honestly, it seems from the reaction so far that Republicans on the Hill are more impacted by the CBO's deficit increase estimates than they are by the number of uninsured people increase estimates.
And that, frankly, feels a little more inexplicable to me, that the Republicans are just saying, this won't add to the deficit. And the CBO, I mean, it's arithmetic. I mean, it's not higher math. It's like, if you cut taxes this much so there's less money coming in, there's going to be less money and a bigger deficit. I'm not a math person, but I can do that part. At least in my head. Jessie, you're on the Hill. What are you seeing over in the Senate? We don't even have really a schedule for how this is going to go yet, right? We don't know if the committees are going to do work, if they're just going to plunk the House bill on the floor and amend it. It's all sort of a big question mark.
Yeah, we don't have text yet from any of the committees that have health jurisdiction. There's been a few bills from other committees, but obviously Senate Finance has like a monumental task ahead of them. They are the ones that have jurisdiction over Medicaid. Their members said that they have met dozens of times already to work out the details. The members of the Finance Committee were at the White House yesterday with President Trump to talk about the bill. It doesn't seem like they got into the nitty-gritty policy details, and the message from the president seemed to mostly be like, just pass this bill and don't make any major changes to it, which is a tall order, I think, for some of the members like Lisa Murkowski of Alaska and Susan Collins of Maine, and even a few others that are starting to come out and raise concerns about some of the changes that the House made, like to the way that states finance their share of Medicaid spending through the provider tax. Lisa Murkowski has raised concerns about how soon the work requirements would take effect because she's saying Alaska doesn't have the infrastructure right now, and that would take a little bit to work out. So there are clearly still a lot of details that need to be worked out.
Well, I would note that Senate Republicans were already having trouble communicating about this bill even before these latest CBO numbers came out. At a town hall meeting last weekend in Iowa, where nearly 1 in 5 residents are on Medicaid, Republican Senator Joni Ernst had an unfortunate reaction to a heckler in the audience. And rather than apologize, well, here's what she posted on Instagram.
Hello, everyone. I would like to take this opportunity to sincerely apologize for a statement that I made yesterday at my town hall. I was in the process of answering a question that had been asked by an audience member when a woman who was extremely distraught screamed out from the back corner of the auditorium, "People are going to die." And I made an incorrect assumption that everyone in the auditorium understood that, yes, we are all going to perish from this earth. So I apologize. And I'm really, really glad that I did not have to bring up the subject of the tooth fairy as well. But for those that would like to see eternal and everlasting life, I encourage you to embrace my Lord and Savior, Jesus Christ.
And what you can't see, just to add some emphasis, Ernst recorded this message in a cemetery with tombstones visible behind her. I know it is early in this debate, but I feel like we might look back on this moment later, like McCain's famous thumbs down in the 2017 repeal and replace debate, or is it too soon? Lauren?
For all the messaging they've tried to do around Medicaid cuts, for all the messaging, we're all gonna die, I cannot imagine was on the list of approved talking points. And at the end of the day, I think it gets at how uncomfortable it is to face the reality of your constituents saying, I no longer have health care. This has been true since the beginning of time. Once you roll out an entitlement program, it's very difficult to roll it back. So I think that this is just a preview of how poorly this will go for elected officials, because there will be plenty of people thrown off of Medicaid who are also Republicans that could come back to bite them in the midterms. And in general, I think could lead, combine it with the anti-DOGE fervor. I think you could have a real recipe for quite the feedback.
Yes, and we're going to talk about DOGE in a second. As we all now know, Elon Musk's time as a government employee has come to an end, and we'll talk about his legacy in a minute. But on his way out the door, he let loose a barrage of criticism of the bill, calling it, among other things, a, quote, disgusting abomination that will saddle Americans with, quote, crushingly unsustainable debt. So basically, we have a handful of Republicans threatening to oppose the bill because it adds to the deficit, another handful of Republicans worried about the health cuts, and then what? Any ideas how this battle plays out? I think in the House they managed to get it through by just saying, keep the ball rolling and send it to the Senate. Now the Senate, it's going to be harder, I think, for the Senate to say, oh, we'll keep the ball rolling and send it back to the House.
Well, and to jump off Lauren's point, I think the political blowback is really going to be because this is insult on top of injury in terms of not only are people going to lose Medicaid, Republicans, if this passes, but they're being told that the only people who are going to lose Medicaid are undocumented immigrants and the undeserving. So not only do you lose Medicaid because of choices made by the people you elected, but then they turn around and imply or directly say you never deserved it in the first place. That's pretty tough.
And we're all going to die.
And we're all going to die.
Just to add on to this, I do think it's important to note that work requirements poll very popularly among the American people. Majority of Americans hear work requirements and say, gee, that sounds like a common sense solution. What the reality that we've talked about in this podcast many, many times is that it ends up kicking off people for bureaucratic reasons. It's a way to reduce the rolls. It doesn't necessarily encourage work. But to the average bear, it sounds great. Yes, absolutely. Why wouldn't we want more people working? So I do think there is some messaging there. But at the end of the day, like Alice said, like I pointed out, I mean, they have not figured out the messaging enough. And it is going to add insult to injury to imply to some of these folks that they did not deserve their health care.
And what's really baffling is they are running around saying that Medicaid is going to people who should never have been on the program in the first place, you know, able-bodied people without children who are not too young and not too old, sort of implying that these people are enrolling against the wishes of the program's creators. But Congress explicitly voted for these people to be eligible for the program. And then after the Supreme Court made it optional, all of these states, most states, voted either by a direct popular vote or through the legislature to extend Medicaid to this population. And now they're turning around and saying they were never supposed to be on it in the first place. We didn't get here by accident or fraud.
Or by executive order.
Exactly.
Well, even before the Senate digs in, there's still a lot of stuff that got packed into that House bill, some of it at the last minute, that most people still aren't aware of. And I'm not talking about Marjorie Taylor Greene and AI, although that too. Among other things, and shout out here to our podcast panelist, Maya Goldman over at Axios, the bill would reduce the amount of money medical students could borrow, threatening the ability of people to train to become doctors, even while the nation is already suffering a doctor shortage. It would also make it harder for medical residents to pay their loans back and do a variety of other things. The idea behind this is apparently to force medical schools to lower their tuition, which would be nice, but this feels like a very indirect way of doing it.
I just don't think it's very popular in an era in which we're constantly talking about physician shortages and encouraging folks that are from minority communities or underserved communities to become primary care physicians or infectious disease physicians, to go to the communities that need them, that reflect them, to then say, oh, look, we're going to cut your loans. And what that's going to do, short of RFK, who has toyed with playing with the codes, so, I mean, who knows? We could see. But as the current structure stands, here's the deal. You have a lot of medical debt. You are incentivized to go into a more lucrative specialty. That means that you're not going into primary care. You're not going into infectious disease care. You're not going to rural America because they can't pay you what it costs to repay all of your loans. So I do think, and it was interesting, I think The Guardian spoke to some of the folks from the study that said that this could change it. That study was based off of metrics from 2006. And for some reason, they were like, the financial private pay loans are not really going to cut it today. I find it hard to believe this won't get fixed, to be quite honest, just because I think, hating on medical students is usually a losing battle in the current system, but who knows?
And hospitals have a lot of clout, although there's a lot of things in this bill that they would like to fix.
And hospitals have a lot of financial incentive because essentially they make medical residents indentured servants. So, they also would like them to have less loans.
As I mentioned earlier, Elon Musk has decamped from DOGE, but in his wake is a lot of disruption at the Department of Health and Human Services and not necessarily a lot of savings. Thousands of federal workers are still in limbo on administrative leave to possibly be reinstated or possibly not, with no one doing their job. In the meantime, those who are still there are finding their hands tied by a raft of new rules, including the need to get a political appointee sign-off for even the most routine tasks. And around the country, thousands of scientific grants and contracts have been summarily frozen or terminated for no stated cause as the administration seeks to punish universities for a raft of supposed crimes that have nothing to do with what's being studied. I know that it just happened, but, how is DOGE going to be remembered? I imagine not for all of the efficiencies that it has wrung out of the healthcare system.
Well, one, I wouldn't be so sure things are over, either between Elon and the Trump administration or what the amorphous blob that is DOGE. I think that the overall, slash and burn of government is going to continue in some form. They are trying to formalize it by sending a bill to Congress to, make these cuts that they already made without Congress's permission official. We'll see where that goes. But I think that it's not an ending. It's just morphing into whatever its next iteration is.
I would note that the first rescission request that the administration has sent up formally includes getting rid of USAID and PEPFAR and public broadcasting, which seems unlikely to garner a majority in both houses.
Except, like I said, this is asking them to rubber stamp something they're already trying to do without them. Congress doesn't like its power being infringed on, especially appropriators. They guard that power very jealously. Now we have seen them, a little quieter in this administration than maybe you would have thought. But I think there are some who, even if they agree on the substance of the cuts, might object to the process and just being asked to rubber stamp it after the fact.
Well, meanwhile, Health and Human Services Secretary Kennedy continues to try to remake what's left of HHS, although his big reorganization is currently blocked by a federal judge. And it turns out that his big MAHA, Make America Healthy Again report, may have been, at least in part, written by AI, which apparently became obvious when the folks at the news service Notice decided to do something that was never on my reporting bingo card, which is to check the footnotes in the report to see if they were real, which apparently many are not. Then, Lauren, you and your colleagues took that yet another step. So tell us about that.
Yeah, Notice did a great job. They went through all the footnotes to find out that several of the studies didn't exist. And my colleagues and I saw that and said, let's look a little closer at these footnotes and see. And what we were able to do in speaking with AI experts is find telltale signs of AI. It's basically a sign of artificial intelligence when things are hallucinated, which is what they call it, which is when it sounds right but isn't completely factual, which is one of the dangers of using AI. And it appears that some of AI was used in the footnote of this MAHA report, again, to, as Notice pointed out, create studies that don't exist. It also kind of garbled some of the science on the other pieces of this. We found something called OAI Site, which is a marker of OpenAI's system throughout the report. And at the end of the day, it casts a lot of questions on the report as a whole. And how exactly did it get made? What is the science behind this report? And even before anyone found any of these footnotes of any of this, a fair amount of the studies that this report cites to back up its thesis are a stretch. Even putting aside the fake studies and the garbled studies, I think it's important to also note that a lot of the studies the report cites, a lot of what Kennedy does, take it a lot further than what they actually say.
So this is all going well. Meanwhile, there is continuing confusion in vaccine land after Secretary Kennedy, flanked by FDA Commissioner Marty McCary and NIH Director Jay Bhattacharya, announced in a video on X that the department would no longer recommend COVID vaccines for pregnant women and healthy children, sidestepping the expert advice of the Centers for Disease Control and Prevention and its advisory committee of experts. The HHS officials say people who may still be at risk can discuss whether to get the vaccine with their doctors. But if the vaccines are no longer on the recommended list, then insurance is less likely to cover them and medical facilities are less likely to stock them. Paging Senator Cassidy, who still, as far as I can tell, hasn't said anything about the secretary's violation of his promise to the senator during his confirmation hearings that he wouldn't mess with the vaccine schedule. Have we heard a peep from Senator Cassidy about any of this?
I have not, but a lot of the medical field has been very vocal and very upset. I was actually at the annual conference of the American College of Obstetricians and Gynecologists when this news broke, and they were just so confused and so upset. They had seen pregnant patients die of COVID, before the vaccines were available, or, because there was so much misinformation and mistrust about the vaccine's safety for pregnant people that a lot of people avoided it and really suffered the consequences of avoiding it. A lot of the issue was that there were not good studies of the vaccine in pregnant people at the beginning of the rollout. There have since been, and those studies have since shown that it is safe and effective for pregnant people, but it was in a lot of people's minds too late because they already got it in their head that it was unsafe or untested. So the OB-GYNs at this conference were really, really worried about this.
And confusingly, the CDC on its website amended its recommendations to leave children recommended, but not pregnant women, which is kind of the opposite of, I think, what most of the medical experts were recommending. Jessie, you were about to add something.
I just feel like the confusion is the point. I think Kennedy has made it a pattern now to get out ahead of an official agency decision and kind of set the narrative, even if it is completely opposite of what his agencies are recommending or are stating. He's done this with a report that the CDC came out with autism when he said rising autism cases aren't because of more recognition. And the CDC report said it's a large part because of more recognition. He's done this with food dyes. He said, we're banning food dyes. And then it turns out they just asked manufacturers to stop putting food dyes into it. So I think it's part of, he's this figurehead of the agency, and he likes to get out in front of it and just state something as fact. And that is what people are going to remember, not something on a CDC webpage that most people aren't going to be able to find.
Yeah, it sounds like President Trump. It's like saying it is more important than doing it in a lot of cases. So, of course, there's abortion news this week, too. The Trump administration on Tuesday reversed the Biden administration guidance regarding EMTALA, the Emergency Medical Treatment and Active Labor Act. Biden officials, in the wake of the overturn of Roe v. Wade 3 years ago, had reminded hospitals that take Medicare and Medicaid, which is all of them basically, that the requirement to provide emergency care includes abortion when warranted, regardless of state bans. Now, Alice, this wasn't really unexpected. In fact, it's happening later than I think a lot of people expected it to happen. How much impact is it going to have beyond a giant barrage of press releases from both sides in the abortion debate?
Yeah, so okay, it's important for people to remember that what the Biden administration, the guidance they put out was just, sort of an interpretation of the underlying law. So the underlying law isn't changing. The Biden administration was just saying, we are stressing that the underlying law means in the abortion context, in the post-Dobbs context, blah, 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 that hospitals cannot turn away a pregnant woman who's having a medical crisis. And if the necessary treatment to save her life or stabilize her is an abortion, then that's what they have to do, regardless of the laws in the state. In a sense, nothing's changed because EMTALA itself is still in place, but it does send a signal that could make, hospitals feel more comfortable turning people away or denying treatment, since the government is signaling that they don't consider that a violation. Now, I will say you're totally right that this was expected. In the big lawsuit over this that is playing out now in Idaho, one of the state's hospitals intervened as a plaintiff, basically in anticipation of this happening, saying the Trump administration might not defend EMTALA in the abortion context, so we're going to do it for them, basically, to keep this case alive.
And I would point out that ProPublica just won a Pulitzer for its series detailing the women who were turned away and then died because they were having pregnancy complications. So we do know that this is happening. Interestingly, the day before the administration's announcement, the American College of Obstetricians and Gynecologists put out a new, quote, practice advisory on the treatment of preterm pre-labor rupture of membranes, which is one of the more common late pregnancy complications that result in abortion because of the risk of infection to the pregnant person. Reading from that guidance, quote, the practice advisory affirms that OBGYNs and other clinicians must be able to intervene and, in cases of pre-viable and peri-viable PPROM, that's the premature rupture of membranes, provide abortion care before the patient becomes critically ill. Meanwhile, this statement came out Wednesday from the American College of Emergency Physicians. Quote, regardless of variances in the regulatory landscape from one administration to another, emergency physicians remain committed not just by law but by their professional oath to provide this care. So on the one hand, professional organizations are speaking out more strongly than I think we've seen them do it before, but they're not the ones that are in the emergency room facing potential jail time for, do I obey the federal law or do I obey the state ban?
And, when I talk to doctors who are grappling with this, they say that even with the Biden administration's interpretation of EMTALA, that didn't solve the problem for them. It was some measure of protection and confidence, but still, exactly like you said, they're still caught in between seemingly conflicting state and federal law. And really, a lot of them, based on, what they told me, we're saying that the threat of the state law is more severe. It's more immediate. It means being charged with a felony, being charged with a crime if they do provide the abortion, versus it's a federal penalty. It's not on the doctor itself. It's on the institution, and it may or may not happen at some point. So when you have, criminal charges on one side and maybe some federal regulation or, an investigation on the other side, what are you going to choose?
And it's hard to imagine this administration doing a lot of these investigations. They seem to be turning to other things. Well, we will watch this space, and obviously this is all still playing out in court. All right, that is this week's news, or at least as much as we could squeeze in. Now we'll play my Bill of the Month interview with Ariel Zients, and then we'll come back and do our extra credits. I am pleased to welcome back to the podcast KFF Health News' Ariel Zients, who reported and wrote the latest KFF Health News Bill of the Month. Ariel, welcome back.
Hi, thanks for having me.
So this month's patient has Medicaid as his health insurance, and he left his home state of Florida to visit family in South Dakota for the holidays, where he had a medical emergency. Tell us who he is and what happened that landed him in the hospital.
Sure. So I spoke with Hans Wirth. He was visiting family in the Black Hills. That's where Mount Rushmore is, and it's beautiful outdoors. He was at a water park following his son up and down the stairs and getting kind of winded. And at first he thought it might just be the elevation difference, because in Florida, it's like 33 feet above sea level. Here it's above 3,000 in Rapid City. But then they got back to the hotel room and he was getting a lot worse, his breathing, and then he turned pale. And his 12-year-old son is the one who called 911. And medics were like, yep, you're having a heart attack. And they took him to the hospital in town. And that is the only place to go. There's just one hospital with an ER in Rapid City.
So the good news is that he was ultimately okay, but the bad news is that the hospital tried to stick him with the bill. How big was it?
It was nearly $78,000.
Wow. So let's back up a bit. How did Mr. Wirth come to be on Medicaid?
Yeah, so it is significant that he's from Florida because that is one of the 10 states that has not opted in to expand Medicaid. So in Florida, if you're an adult, you can't just be low income. You have to also be disabled or caring for a minor child. And Hans says that's his case. He works part-time at a family business, but he also cares for his 12-year-old son who is also on Medicaid.
So Medicaid patients, as we know, are not supposed to be charged even small copays for care in most cases. Is that still the case when they get care in other states?
So Medicaid will not pay for patient care if they are getting more of an elective or non-medically necessary kind of optional procedure or care in another state. But there are several exceptions, and one of the exceptions is if they have an emergency in another state. So federal law says that state Medicaid programs have to reimburse those hospitals if it was for emergency care.
And presumably a heart attack is an emergency.
Yes.
So why did the hospital try to bill him anyway? They should have billed Florida Medicaid, right?
So what's interesting is while there's a law that says the Medicaid program has to reimburse the hospital, there's no law saying the hospital has to send the bill to Medicaid. And that was really interesting to learn. In this case, the hospital is called Monument Health, and they said they only bill plans in South Dakota and 4 of our bordering states. So basically they said for them to bill for the Medicaid, they would have to enroll. And they say they don't do that in every state because there is a separate application process for each state, and their spokesperson described it as a burdensome process. So in this case, they billed Hans instead.
So what eventually happened with this bill? He presumably didn't have $78,000 to spare.
Correct. Yeah, and he had told them that, and he said they only offered, hey, you can set up a payment plan, but that would have still been really expensive, the monthly payments. So he reached out to KFF Health News, and I had sent my questions to the hospital. And then a few days later, I get a text from Hans, and he says, hey, my balance is at 0 now. He and I both eventually learned that that's because the hospital paid for his care through a program called Charity Care. This does all nonprofit hospitals are required to have this program, which provide free or very discounted pricing for patients who are uninsured or, very underinsured. And the hospital said that they screen everyone for this program before sending them to collections. But what that meant is that for months, Hans was under the impression that he was getting this bill, and he got a notice saying, this is your last warning before we send you to collections.
So maybe they would have done it anyway, or maybe you gave them a nudge.
They say they would have done it anyways.
Okay. Well, so what's the takeaway here? It can't be that if you have Medicaid, you can't travel to another state to visit family at Christmas.
Right. So Hans made that same joke. He said, quote, if I get sick and have a heart attack, I have to be sure that I do that here in Florida now instead of some other state. Obviously, he's kidding. You can't control when you have an emergency. So the takeaway is that you do risk being billed, and that if you don't know how to advocate yourself, you might get sent to collections. But I also learned that there's things that you can do. So you could file a complaint with your state Medicaid program, and also if you have a managed care program, and they might have they usually ask for a caseworker, like, hey, can you communicate with the hospital? Or you can contact an attorney. There's free legal aid ones. An attorney I spoke with said that she would have immediately sent a letter to the hospital saying, look, you need to either register with Florida Medicaid and submit it. If not, you need to offer the charity care. So that's the advice.
So basically, be ready to advocate for yourself.
Yes.
Okay. Ariel Zients, thank you so much.
Thank you.
Okay, we're back, and it's time for our extra credit segment. That's where we each recognize a story we read this week we think you should read too. Don't worry if you miss it. We will put the links in our show notes on your phone or other mobile device. Jessie, why don't you go first this week?
My story is from the New York Times. It's called "A Technique is Finding Women Who Left Their Babies for Dead," which I don't know how I feel about that headline, but the story was really interesting. It's about how police departments are using DNA technology to find the mothers of infants that had been found dead years and years ago. And it gets a little bit into just the complicated situation. Some of these women have gone on to have families. They have successful careers, and now some of them are being charged with murder. And some who have been approached about this have unfortunately died by suicide. And it just gets into the ethics of the issue and what police and doctors, families should be considering about the context around some of these situations, about what the circumstances were, in some cases 40 years ago, and what should be done with that.
Really thought-provoking story. Lauren.
With credit to Julie, too, because she brought this up again, was brought back to a classic from the New York Times back in 2020, which is called Take a Quiz. Could you manage as a poor American? And here are the questions. I will read them for the group.
And I will point out that this is once again relevant. That's why it was brought back.
It's once again relevant. And one of them is, do you have paper mail you plan to read that has been unopened for more than a week? I mean, yes, I'm looking at paper mail on my desk. Have you forgotten to pay a utility bill on time? If I didn't set up auto pay, I probably would forget to pay a utility bill on time. Have you received a government document in the mail that you did not understand? Many times. Have you missed a doctor's appointment because you forgot you scheduled it or something come up? I mean, these are the basic facts that can derail someone from having access to healthcare or saddle them because they lose access to healthcare and don't realize it with massive hospital bills. And this is a lot of what we could see in the coming months if some of these Medicaid changes come through. And I think I would challenge a lot of people to think seriously about how much mail they leave unopened and what that could mean for them, especially if you are living in different homes, if you are moving frequently, et cetera. I mean, this paperwork burden is something to definitely be considered.
Yeah, I think we should sort of refloat this every time we have another one of these debates. Alice.
So I wanted to recommend something I wrote. It was my last story before taking some time off this summer. It is about the intersection of Trump's immigration policies and our healthcare system. And so this is jumping off the Supreme Court allowing the Trump administration to strip legal status from hundreds of thousands of immigrants. Again, these are people who came legally through a designated program, and they are being made undocumented by the Trump administration with the Supreme Court's blessing. And tens of thousands of them are healthcare workers. And so I visited a elder care facility in Northern Virginia that was set to lose 65 staff members. And I talked to the residents and the other workers about how this would affect them and the owner. And it was just a microcosm of the damage this could have on our health sector more broadly. Elder care, is especially immigrant heavy in its workforce. And everyone there was saying, there just are not the people to replace these folks. And not only is that the case right now, but as the baby boomer generation ages and requires care, the shortages we see now are going to be nothing compared to what we could see down the road. With the lower birth rates here, we're just not producing enough workers to do these jobs. The piece also looks into how public health and management of infectious diseases is also being worsened by these immigration raids and crackdowns and deportations. So would love people to take a look.
I'm so glad you did this story because it's something that I've been keep sort of running up and down screaming. And you can tell us why you're taking some time off this summer, Alice.
I'm writing a book. Hopefully it will be out next year, and I can't wait to tell everyone more about it.
Excellent. All right. My extra credit this week is from my KFF Health News colleagues, Catherine Houghton, Jasmine Arroco Rodriguez, and Ariel Zients, who you just heard talking about her bill of the month. And it's called Native Americans Hurt by Federal Health Cuts Despite RFK Jr.'s Promises of Protection. And that sums it up pretty well. The HHS secretary had a splashy photo op earlier this year out west where he promised to prioritize Native American health. But while he did spare the Indian Health Service from personnel cuts, it turns out that the Native American population is also served by dozens of other HHS programs that were cut, some of them dramatically, everything from home energy assistance to programs that improve access to healthy food to preventing overdoses. The Native community has been disproportionately hurt by the purging of DEI programs because Native populations have systematically been subjected to unequal treatment over many generations. It's a really good, if somewhat infuriating story. Okay, that is this week's show. Before we go, if you will indulge me for a minute, this is our 400th episode of What the Health. We launched in 2017 during that year's repeal and replace debate. I want to thank all of my panelists, current and former, for teaching me something new every single week, and everyone here at KFF Health News who makes this podcast possible. That includes not only my chief partners in crime, Francis Yang and Emery Hudeman, but also the copy desk and social media and web teams who do all the behind-the-scenes work that brings our podcast to you every week. And of course, big thanks to you, the listeners, who have stuck with us all these years. I won't promise you 400 more episodes, but I will keep doing this as long as you keep wanting it. As always, if you enjoy the podcast, you can subscribe wherever you get your podcast. We'd appreciate it if you left us a review. That helps other people find us too. Also, as always, you can email us your comments or questions or at whatthehealth, all one word, at kff.org. Or you can find me on X at jrovner or on Blue Sky at Julie Rovner. Where are you folks these days, Jessie?
At Jessie Hellmann on X and Blue Sky and LinkedIn.
Lauren?
I'm at Lauren Weber HP on X and on Blue Sky, shockingly. Yeah.
Alice?
At Alice Miranda on Blue Sky and at Alice Ollstein on X.
We will be back in your feed next week. Until then, be healthy.